charge to patients coming in. There's not a cost to that, and so this is something that is an early treatment for people who have already tested positive for COVID-19. It also is authorized to be used as a prophylaxis for people who are especially vulnerable to COVID-19, who may have had exposure to somebody who was COVID-19 positive. And so we've had this, we've had Regeneron, Eli Lilly, we've had a number of monoclonals. This is offering Regeneron, in all our clinics throughout Florida that we've been opening are offering Regeneron, partially because Regeneron has been proven to be effective against the Delta variant in a way that some of the other monoclonals maybe have not. Regeneron also is the only monoclonal that's approved for prophylaxis, so if you have positive cases in a nursing home, for example, you can go and offer that to residents of the nursing home that may have been exposed, as well as others in the community as that's appropriate. And Regeneron can be applied through an IV, but also they can do it subcutaneously. And so an IV, you're there in the chair for an hour. The sub-Q, it's basically 4 shots, usually 2 in the arm, 2 in the belly, and that can be done much quicker. And so what you end up doing, you can see more patients if you have the option to do the sub-Q. And what they do is once they're done with the shots, they're observed for an hour, just like they would be with the IV, but then you can continue to move people in to be able to do it. This has been available. The emergency use on this was approved similar to when the vaccine emergency use were approved. And it has been used by health systems and doctors throughout. It has not been something that was as known, and we figured that out as we started to see hospital admissions go up. We had talked to hospital executives. They talked about this was something the patients that did this tended to not end up in the hospital, and people were asking questions. A lot of people didn't know about it. So we thought it was important to, one, raise awareness, let people know that, hey, if you're COVID positive, this is something that you can do early, and it really does have a good track record of reducing hospitalizations, and that's really the name of the game here. Try to reduce those admissions. Take this for something that, with the Regeneron, can convert it into something that's much more mild. People recover much quicker, and that's really the name of the game. Up to this point, you had to get a prescription from a physician, and then most of the health systems would have infusion centers, so you go, you get referred, and you do it, and they've done a good job. What we've been able to do is do a standing order through the Surgeon General here in Florida, which takes that step out. So if you meet the criteria under the emergency use authorization, you can come in without having to go to a doctor first, and this is, again, really effective when it's done early. And so people may become COVID positive. Maybe they develop some symptoms. When its symptoms aren't that bad, sometimes people would say, hey, it's going to be fine. But if you're in those high-risk categories, that is the time when you come in and get this, and it can be really effective. If you wait a couple weeks and you get really, really ill and you require hospitalization, the monoclonals at that point are not likely to be as effective. So early is key, and then obviously for those who are in those different areas. And this is for people who are vaccinated or unvaccinated. I mean, obviously, the vulnerable parts of the community, have been vaccinated for many, many months. I mean, we have here in Lee County, I think over 80% of people 50 and up have been vaccinated. Of course, seniors, we've done close to 4 million seniors throughout the state of Florida, and it's helping to reduce severity. But you do see folks who may be immunocompromised and may be vaccinated. If they end up COVID positive, this is still something that could be beneficial, and you are seeing, of course, positive tests with people who were vaccinated, and so it's not an either or, it's not mutually exclusive. The vaccines are designed to prevent severe illness on the front end, but then once you're infected, once you're COVID positive, what do you do? And this is an early treatment that has had some success. So the folks that this is really geared towards are those who are at most risk of severe COVID outcomes. So that includes people that are immune compromised. It includes people that are elderly, that have kidney problems, diabetes, obesity, and chronic cardiovascular or lung conditions. And so if you have any of those conditions and you're COVID positive, early in the treatment coming here, this is a great chance to keep you out of the hospital. And we've had great feedback from folks throughout Florida. Many people didn't know about it. Many people have gone in and they've reported really good results. I mean, really good resolution of symptoms within even 24 hours sometimes. And this includes, again, people that are vaccinated or not vaccinated, because the most vulnerable people, by and large, have been vaccinated. So if you have a nursing home resident, for example, who tests positive, this is still a viable option for them as well. So we are expanding these. We're raising awareness, which is great, because when you talk to folks who are involved in our hospitals, the people that have been admitted for COVID-19, not just incidentally positive, which they also count in numbers, but people actually being treated for COVID-19, the vast majority of those people had not been vaccinated. The people that are being treated for COVID that are vaccinated tend to be the very vulnerable folks, immune compromised and the like. And so that data has been pretty consistent across the state in terms of who's ending up in the hospital. But it's also the case, we've spoken with some of the major health systems, of the people that get admitted to the hospital for COVID, over 90% of them did not get a monoclonal antibody treatment early in their infection. And so we really believe that if this is something that is a matter of course, where people know that they can do it, and we absolutely think that you will see a reduction in hospital admissions, and that will be something that will be really, really positive. So we have this site here in Southwest Florida 7 days a week. We also have sites in Brevard County. We have a site in Broward. We have a site in Duval County, Hillsborough. Okaloosa County will be open today. Orange County, Palm Beach, Pasco, and Volusia. And we're having more. We're working on it to get more. So there'll be others in other parts of the state. And the goal is to just kind of have it to where all the population centers have some access to this. And we're trying to get it to where people don't have to have like a 4-hour drive and try to do it. So we're getting there, and we think it'll end up being good. If you want to make an appointment for one of these treatments, go to patientportalfl.com. You can also see all the locations in the state at floridahealthcovid19.gov. And don't forget, what we're doing in the state is supplementing what the health systems are doing. It is not displacing that, and they're still doing. So, for example, as soon as Regeneron was out, you had some of the big systems. I remember talking to Tampa General. They had infusion centers immediately and have been doing it. And so they'll do 50 a day, let's say. Well, these here that we're doing will be 300 plus a day. So it's really adding a lot, but they're still available through the health systems. And so if you have a physician, they very well may refer you there, and that's fine. It's going to be the same basic treatment. And so early is key, and we think that this is something that if you look at kind of how this is progressing, look at like what's happening in Israel, you look at some of these other places, the vaccinations are really helping reduce severe illness. But clearly, we do see infection waves, of course, here in Florida, the Sun Belt this summer, but even places like Hawaii and other places, Israel, one of the most vaccinated places on earth. And so it's really, you need to have all the tools in the toolbox there. And so the prevention component to prevent severe illness on the front end, but then as you do have infections, what do you do on the back end? And the monoclonal antibody, that early intervention, is probably been the most effective that we've seen so far, at least anything that's been approved by the FDA. So a lot of people have been helped by this. We have different people. You got to look at the data. The data is very good, and it shows the reduction in people that get admitted to hospitals, and it's great. And you got to be careful about anecdotes when you're dealing with this. But I will say, just having been dealing with this now for December, when Regeneron came out in the Eli Lilly, talking with people who have gone through a COVID infection and then gotten this, the results and the testimonials are very, very positive. And you see that consistently people really say that this helped them a lot. And so we have somebody here who's going to say a few words about it, Senator Pasadomo, because she can personally attest to the impact that this has. So I'm going to let her come up and share her story with you.
Oh, thank you so much, Governor DeSantis. I'm thrilled to be here for a lot of reasons, because I am here. And this is a wonderful opportunity for all of us in Florida. And I'll tell you why. In January, my husband contracted COVID, and of course, he gave it to me. We had been careful. We got COVID, and we immediately reached out to Naples Community Hospital. Within 3 days, we both had the monoclonal antibody infusion. I had absolutely no symptoms. I was back on track within a day. It was seamless. It was a terrific experience. They treated us well. And so my message to everybody is it's working. It's worth it. My husband is immunocompromised. He was fine. I'm a little overweight. I was fine. It is the best thing that we could do. And Governor, I am so excited that you are taking this on, because there is nothing better. And I just want to also mention my colleagues who are here, because none of them have had the opportunity to have the monoclonal, but Representative Jim Lombardo, Congressman Donald, Senator Rodriguez, Representative Persons Mullica, and 2 commissioners, Santelli and Brian Hammond, are all here because we support the governor in this terrific initiative. And, keep it up. Yep. Thank you.
Senator, had you been vaccinated?
I got vaccinated in April. It was early on in vaccination. I was not, I wasn't eligible at the time. So now I'm vaccinated. I got it all. I'm in great shape. Thank you.
Okay, Kevin Guthrie.
Thank you very much, Governor, for your leadership and getting this and your support of the division to get these open. I want to start real quick by thanking Sandra Taframani. She has been instrumental in getting this opened up here locally, Lee County EM Director and her staff. So again, Sandra, thank you so much for your support. I want to thank the county commissioners here, the city of Bonita Springs. This is going to be a fantastic facility. As you see, there's plenty of room for expansion. If we should end up having quite a few people show up and we get to our limit, we will be able to expand the site as well. So we're looking forward to great things here. Governor, again, thank you for your support and your leadership.
Great. And so we think that there's now much more awareness of this. And look, it's understandable. I mean, I remember when November, December of last year, the Pfizer data started coming out, all this other stuff, the Regeneron stuff, and the Eli Lilly data was coming out too, Moderna. But I mean, clearly, a vaccine is going to be much more pertinent to people because most people at any given time are not infected, and so they want to be able to do it. So most of the, I think, however, in terms of just what people were talking about, the buzz, all that. Now, this was something that was being done with the monoclonals, but the hope was, you have all this, get all these many millions of people access to the Pfizer, the Moderna, then the J&J. And so this was being used, but it was not something that was on the front burner. So now we're in a situation where clearly we've seen and identified a lack of understanding of this, that people weren't aware of it. And so what we're doing is we're expanding access for people to make it as easy as possible, but really just increasing the awareness of it. And so people know now, particularly if you're in those high-risk categories, okay, hopefully you don't get infected. Hopefully the vaccine prevents it, but we know people are getting infected, both vaxxed and unvaxxed. Then the question is, what do you do then? And this early treatment, this early intervention has proven to be the most effective, and you hear the testimonials all the time, and we're able to be able to provide this service for folks. So we're going to end up opening, so what do you think, probably another 4 or 5?
Based on what you and I talked about, we're going to be at 21.
21. So we hope by early next week that there will be 21 of these sites throughout the state of Florida. I think every one of them is 300 capacity, 300 to 320 capacity. Some are more, so we expanded the Broward one to just do double. And if the demand says, as Kevin said, you can expand accordingly. So we are going to be able to do thousands and thousands of these treatments every day, over and above what our health system's already doing, which is also a lot. So if you look going forward, how do you reduce hospital admissions? I mean, this is going to be an important tool in that toolbox to do that. And I absolutely believe if people had known about this and there had been more of this, I definitely think you have a lot of these people that ended up getting admitted probably wouldn't have been admitted. And so hopefully going forward, we'll be able to see that. I think we actually already are seeing it on small level in certain areas where this has really taken off. So we want to keep that momentum going. But at the end of the day, it's between the vaccines and between the monoclonals, you really can convert COVID into basically a flu-level risk if people are availing themselves of this. So it doesn't mean you will never get infected. We kind of hope that the vaccination would create a herd immunity. CDC is saying that's not going to happen. And so that's fine. But man, it's a big difference between having a cold-like symptoms for a couple days versus having something that's going to make you seriously ill and put you in the hospital and potentially even cost you your life. And so these tools are available, and both on the prevention end and on the treatment end, and we're raising the visibility about the treatment, particularly just given that we're seeing kind of how some of this stuff has been unfolding not only in the United States but in other parts of the world. So it gives us that extra tool that we need, and we're happy to be able to do this in Southwest Florida. We think the demand will be good. I think it's been good in other parts of the state, and you don't know when you go in, like, is this something people are going to want? I think we've been able to really hit a spot where people are interested in it. And again, this is free of charge to the patient. I mean, when you see, we live in a world in which there's a lot of misinformation put out there. A lot of it is intentional on the part of people that have partisan agendas. The fact of the matter is, Regeneron was purchased by the federal government lock, stock, and barrel last year. They bought the whole supply out. And so whatever Florida draws down, we draw down. It's already been paid for by the feds. And then whatever's administered to patients has already been paid for. So the patients are not going to be charged money for it, certainly not going to be charged thousands of dollars, which is what people said. And so be careful about some of the agendas that people have, because if they dissuade one person that this could help from coming in, that could be the difference between resolving the illness and maybe somebody ending up in the hospital or even worse. And so you wouldn't want to have that as something that you were a part of. And so these are free, they're accessible, and again, there's a standing order. As long as you qualify under the EUA, you're going to be able to have access to. But please do it early. Once this progresses to a certain part, then this antibody treatment, it's just not going to be as effective. I mean, when the virus hits you, most people create an immune response. They develop antibodies and they fight it back. That's why most people recover from this without much of a problem. But others may not do that as well, particularly those in those at-risk categories. And so this is kind of creating this antibody cocktail. These are the antibodies that can then fight back the virus. That's why you see symptoms resolved in 24 hours, like Kathleen said, because that's really doing the job that the immune system is normally doing. And so all in all, we think that this is be a key to reducing hospital admissions, and we encourage anybody who wants this, that just to let them know that it's available, and there'll be more sites over the next probably the next three or 4 days, and then we'll end up with 20 or 21 sites throughout the state of Florida doing 300 plus treatments a day. So that's a big thing. We're the first state to really do this and lean into this, and other states are now starting to follow, which I think is good, and I do think it'll make a difference in keeping people out of the hospital and ultimately saving lives. Okay.
Do you have any concern that this will act as a safety net? People will say, I don't need to get vaccinated.
No, not at all, because a couple things. We have our emergency management chief medical officer, Dr. Shepke, made the point yesterday. You get vaccinated today, go do it. I mean, but understand, it takes some time for that to kick in. And so when you're in a period where you have higher prevalence in the community, there needs to be something available for people if they are infected, and then what do you do as a result of that? It's not a substitute for trying to have prevention, but at this point, if you're somebody that is not vaccinated and you're infected, the vaccine is not going to serve as a treatment for the current infection. You really need to have the vaccine and have that many weeks in advance of you being exposed. And so it's not an either-or thing. Ideally people would do both, but regardless of that status, if you find yourself infected, you want to do this. I mean, obviously the best thing would be to not have any positive, although we do have to acknowledge, I mean, and the CDC is acknowledging this readily, that there's a lot more people testing positive who are fully vaccinated than the clinical trials suggested would happen. And so, okay, you deal with that. And since we have our vulnerable population, by and large, have been vaccinated many, many months ago, even if it's providing really good protection, the fact that you will have more exposure there, they want to have access to this, they can go ahead and do it. And so you can do both, and I think that's appropriate.
Governor, what other options is the state considering on top of these clinics to help hospitals that are feeling overwhelmed with COVID-19 patients?
Well, this is the best thing we can do. I mean, it's a 70% reduction in hospital admissions for people who do this early and do it timely. And heck, if we even got 25% reduction, that would be a huge, huge relief. And so I think this is probably the most significant thing we can do to keep people out of the hospital. It's not something that's done lightly. I mean, this is a lot of logistics. We're putting a lot of effort behind it, but ultimately we think that this can really make a difference, not only raising awareness, but of course providing additional access.
Considering any field hospital options at this point?
We've not had any requests for that.
The mayor would like to thank you, Governor.
Oh.
The Mayor, Rick Steinmeier of Bonita
Okay.
Springs. Thank you for coming to Bonita Springs.
Yeah.
There's nothing more important than keeping our people safe and healthy. And the effort that's coming into this is tremendous. And thank you so much for being our governor.
Yeah, no, we're happy to do it. I mean, and I do want to just say thanks to some of the state agencies involved, Department of Health, Division of Emergency Management. We viewed a lot of this, whether it was initially some of the stuff we were doing in the nursing homes for testing and prevention with PPE, then when we came to vaccine distribution, and now with the monoclonal. We're a hurricane response state that deals with natural disasters, and so we have great machinery, and we put that to use on here. So with the vaccinations, I mean, many of you remember being down in Southwest Florida. We'd come in, we'd go to a senior community, we'd knock out thousands of shots within a couple days. We would actually go and do home visits and help vulnerable seniors. We did 26,000 home visits for seniors to be able to get vaccinated during 2021, and of course providing it to hospitals, providing it to tests or to some of the big vaccine sites, getting it into the retail pharmacies. That's made it so much easier for so many people, and I remember being down here doing that. But all of that requires an enormous amount of logistical know-how, and it's not easy to do a lot of that stuff. And so now here with the monoclonals, we're in a situation where, okay, how do we really make a difference on this? And these guys, literally within 24 hours, they can have a site up and running in areas that have requested them. And so as people come in and ask, we then do it. The response has been really good. It does help, too, for us that they do offer the IV, but most of it is going to be the subcutaneous, because that is so much quicker and allows us to do more patient volume. But it's a lot of logistics that goes into it. And I remember with the vaccine, we literally would get a call from, a state senator like Sarasota, hey, we need some in this part of the county. And within 24 hours, we could be down there because of these guys, and we would have a site where it'd say, we'll do 3,000 seniors over the next 3 days, or they'd ask for somewhere else and you do it, or they'd ask for home visits and we'd be able to do that. So there's a lot of logistics that goes into it, and there's been a lot of work, and so it's a significant mobilization, but I think it's something that we're happy to do. I mean, at the end of the day, I want to do things that are going to make a difference. I mean, a lot of the stuff that's done, unfortunately, I think has been more for show. What's actually going to make a difference? This will 100% actually make a difference. It's requiring logistics, it's requiring manpower, it's requiring resources, but it's going to make a difference in people's lives. And so we're going to be there, we're going to do it.
Governor, on behalf of Lee Health, I want to thank you for doing this. This is going to be a game changer for us. It'll offload the infusions that we're doing in our ED. It'll also keep people out of the hospital. So thank you. It makes a big difference.
Happy to do it.
With these clinics specifically, since there's only a certain number of treatments that will be given every day, what screenings will be done when patients come in to make sure that they qualify, to make sure that the right people are getting this treatment?
Well, right. So that, you have the criteria listed in the emergency use, which we've done. So obviously we want people to meet that. But if you end up having people that qualify that exceed the 300, we will expand internally here and do that. We had to do that in Broward because there was a lot of demand. And some of this stuff kind of shakes out. I mean, there have been some people who have kind of gone to some of these sites who've already progressed to where they really do need hospitalization at that point. Now, they'll still treat them if they can, but the results are not likely to be what it would be if you do early. And so, but I think we're stressing the early treatment saves lives. That's what we're trying to stress. So just letting people know, as a matter of course, hopefully you don't get infected, but if you do, and here's the thing, the Delta, this is aerosolized, and so it's not like someone needs to even sneeze on top of you for this to be able to be in the air and for you to get infected. And so that's why you're seeing, this is just more transmissible than what we were dealing with previously. So it's not a moral failing if you get infected. It doesn't mean you did anything wrong. It's like, as long as people are having to breathe air, this is going to be something that is there when it's aerosolized. That's just the bottom line. And so it'd be foolish for us not to just recognize that and then say, okay, if that does happen and you're in these groups, what can you do? But I think that this is we do up to 320 at this site, and I think that's probably going to be good, but if we need more, we'll do more. And then the idea with here in Bonita is like, okay, you got Collier-Lee communities that can kind of both come, but if there needs to be an internal expansion, you can do that. We're also looking at, we opened one in Pasco County there, and the thought was that can deal with Pasco, probably Hernando, Citrus, maybe even Northern Pinellas. We opened one in Hillsborough. In Tampa, we're probably going to do one. Pinellas is going to be. We're going to do Pinellas County this weekend. Hopefully, we're trying to get that open. We're going to have one in Manatee County, and then we'll look to see, okay, between Manatee and Bonita, do we need one in kind of that Charlotte, Sarasota area? We may. So we're looking at doing that, and then we're also looking at doing some more in the middle of the state, places like the Villages, places like Alachua County, as well as looking on the east coast of Florida. We have Jacksonville, Ormond Beach, Merritt Island, West Palm, Broward, and Miami-Dade. Is that tomorrow?
Miami-Dade, it will open tomorrow, and then we're looking at that one in possibly St. Louis.
Yeah, so if we have Merritt Island to West Palm, like, okay, where in between there can we get one that will make it? So we're looking at potentially St. Lucie County to be able to open one there. So the goal would be, if you look, and then we're going to do two in the Panhandle today. So we'll have one in Bay County and one in Okaloosa County. And so the goal is okay, where's our population centers? If we have 21 of these, is this going to be able to be relatively easy access for the vast, vast majority of people? And I think it will be. I can't say it's going to be 5 minutes from everybody, but at a minimum, if we could get something that is at least drivable, then I think we're providing a lot of good access. And again, this is in addition to what a lot of the hospitals are doing, and a lot of the doctors, individual physicians are doing this too. And so this is not the only way to get it. I mean, obviously we want to fill these slots. I mean, we want to fill the slots. We want to take as much burden off the health systems as we can. But at the end of the day, this is only one way to do it. So if you are in an area, if you have a doctor in town that can do it, and you don't want to drive an hour, depending on where you live, that's an option too. And so this is it's a team effort here. We want to do as much as we can.
Will patients be tested to kind of respond?
What's that?
Will patients be tested when they come here?
I think the thought is they're already COVID positive, yeah. So now, and we haven't had as much come into the sites, we have sent teams. We sent a team into an area in the Sarasota area to apply it as a prophylaxis to some nursing home residents. So that would be one where you wouldn't need to be COVID positive. If you came in and said, hey, I'm in a household, I'm high risk, and I have both of my, maybe it's a grandmother living with parents and stuff, say they've all tested positive for COVID. Yes, I'm vaccinated, but I would still like to do this. That would absolutely qualify if you've had high risk exposures. But most of the people are already going to be symptomatic, or already going to have tested positive for COVID one way or another. Now, you have people who are high risk, people who are vaccinated, test positive, may not even have any symptoms. You can still come and do this. I mean, because you don't want the symptoms to develop. And so this is something that people are doing in those situations as well. And I think that that's very, very appropriate. So,
is there any limit to what the number of doses that might be available?
There doesn't seem to be now. I mean, this is something that the federal government bought a whole bunch of it. It's been relatively underutilized. And so we can order, I think, 10,000 at a time?
And we did that already. So I think we've even done a replacement.
Yeah, so we're churning it out. They've got it in stock. They're providing it. And I do think, though, I think we'll be fine in the near term. but I know Texas is going to do some sites like we're doing, and I think you're going to see more attention to it in some other states as well, particularly as we get into the fall and winter and you start to see Delta, surge in other parts of the country. I think there's going to be more interest in this, and so hopefully there'll be enough down the line. But right now, we can order 10,000 doses every crack we want, and they get here within 24 hours, right? Yeah. So they've done a good job. And I got to say, I mean, starting with Warp Speed and then now, a lot of this stuff that the feds have helped with, I mean, they have done a good job of getting us, by and large, what we need. I mean, for Warp Speed, so much could have gone wrong. And there were some times where we didn't know the vaccines, but all things considered, with such a massive logistical effort, it was pretty good, wouldn't you say? I mean, I think that it's, you got to give credit where credit's due, because these things can easily get swamped in bureaucracy. And when we started seeing the need to raise awareness about this and then potentially offer our own so that people could do, that was a concern of ours. Well, how much can we get? And they were like, you can get it. It's there. And again, it is free to the state and to the patient. The federal government has bought all of this. So the U.S. taxpayer, yes, has already paid for it, but you are not paying for anything at point of sale. And whether we use 10,000 in a week or 1,000 in the week, it's already been purchased either way. And so that's just what people should do. So please don't be dissuaded about getting treatment that could help you if you're somebody that is COVID positive, high risk, or somebody that's been exposed and is high risk. Come here. You're going to be able to do it. And again, you have the patientportalfl.com. You also have the Florida COVID health website that has that. There's also, you can also look up, is it on the health portal where you can look up all the Regeneron sites in addition to us? Yeah. So there's sites available. HHS has one as well, where you can look to say, where do they offer the Regeneron generally, even apart from here? So we'll have all our sites listed, but then there'll also be which physicians are offering it, which this. And what I think we found is in communities, sometimes they will offer it, but they may only offer like one day a week. Which is better than nothing, but if you're in a situation where you really need it and you don't want to wait 6 days, then you come here. But if you're in a situation where they could see you that next day, then you could go ahead and do that as well. And again, the Regeneron is what we're using. Eli Lilly has one, and I think there's another one that's actually would cost a lot. But the Regeneron has performed the best against the Delta variant. It's been just as effective as before. It's the only one that can be applied subcutaneously, and it's the only one that's been authorized for use as a prophylaxis. So we wouldn't be able to go into a nursing home and help the residents who may have been exposed if there's cases there with some of the other monoclonals. So that's part of the reason why we're doing the Regeneron. Okay, I got to run to the next stop, but thanks everybody. Great to see you.